Good afternoon, everyone. My name is Rosemary Higgins, and I'm the director at the American Center. Thank you so much for joining us today. I'm delighted to take part in today's webinar. We're very excited about the program and we think you'll really enjoy it. So I just want to tell you a little bit about our goal today. So social distancing is not an option for many persons with disabilities, as they rely on personal support workers and caregivers to support to their basic needs. The webinar today is aimed at highlighting the requirements of the disability sector during COVID and discussing the role of media in voicing concerns, challenges, and requirements of persons with disabilities. So now I'd like to hand it over to our program moderator, Sirum Joshi, to tell us a little bit more about today's panelist and get this started. Over to you, Saurabh.
Thank you, Rosemary, and thanks to the American Center and Sarthak for organizing this. Thank you also to all the people who joined us to explore and look through the media lens on disability and the challenges facing people with disability during this time of the COVID pandemic. I encourage all of you to ask as many questions as possible on the Sarthak Facebook page or the American Center page. You can also submit your questions in the chat box on this webinar. This webinar is live. Before I begin the discussion, I'd like to remind all the participants and audience here that Mr. Atul Bhattagar will be summarizing all the sessions at the end of this particular discussion. So it would be great if you would stick around for that to get his updates and summaries and commentary on the day's sessions. So I'd like to start with Subrata Chakrabarti. He is the director of the Advanced Institute of Digital Marketing. Thank you, Subrata, for joining us.
Hi, thank you. Thank you everybody who is watching us. It's a great opportunity to interact with you people, especially people with having disabilities. And we have seen pre-COVID session also where they always depend on the people who are the caregivers, and they always need support of their relatives, friends, teachers to do their everyday work. Forget about the earnings and jobs. Now post-COVID, the situation has changed. Rather, I would say it would be an opportunity for these people who cannot move out of their home without any support for their caregivers. Now, this is a new normal. It is not only the people with disabilities, rather the people who are having all abilities in the senses that we are talking about, they also started working from home. Now this new normal thing, like people are not aware of the words like artificial intelligence, machine learning, work from home and passive incomes. Now these are very common. So people who have difficulties in move out from home, now it is an opportunity because everybody is having internet, having their minimum infrastructure at home from where they can interact with the world. In fact, the smaller cities have bigger opportunity because they never had this kind of threat that having this highly paid real estate where they have to have an office, infrastructure, their support staff as a receptionist and office executives. Now everybody can work from their home, sitting in any part of the world with the help of internet, machine learning and internet. Since I am from the digital marketing background, now there are a lot of opportunities to earn from digital marketing, which would be like active earning also, at the same time it's a passive earning also. People can pursue their hobbies and make money. Suppose you love making films, you can upload your video in a lot of video sharing platforms and you can monetize that. If you are your hobby is to write, you can start your blog, monetize it, associate yourself with the affiliate marketing. And whenever people are visiting your site, there are some activities and you can generate money. So I think the post-COVID situation, it's a boon for people who earlier is unable to move out from their home for any reason. I'm not talking only about the people with disabilities. People who have other, people who are having abilities also to move out of the home, but they cannot for the circumstances. Now they can also take this opportunity and start earning from home.
So Subrato here thinks that there's actually a lot of opportunity that has made itself available to persons with disability, given that virtually all of us are now working from home. I'd like to open this discussion up to our other panelists, and I'd like to begin by introducing them. We have Devina Gupta from the BBC and Sujata Raghunath from the Hindu newspaper. I'd like to throw this question open to all of you. How are persons with disability, in your view, impacted differently from the rest of us? I mean, we know that COVID-19 affects every single person on this planet. How does it affect persons with disability, especially? Devina, could we start with you?
Sure. Hi, everyone. And thank you, Saurabh. And hi, Nazmeen. Thank you for translating everything that we are saying. And I can tell you that it's an honor to be here on the invitation of the Sarthak organization. And Saurabh, to answer your question, I think media plays a greater role in creating that awareness of how people with different disabilities are facing the situation. And I can say from the reports that I've seen, since we're all in a lockdown, and it's quite difficult to go on the ground and try and see it for myself as well. But I'm talking from the reports that I've seen. There has been a consistent coverage as well of a lot of stories on how people are beating the odds. So I would say people who are overcoming their challenges and still trying to survive. So one positive coverage that I have seen consistently are the Samaritans who have come together to help people. Something that Subrata mentioned about caregivers. Now, the BBC itself has covered stories around groups and organizations coming together to help disabled people across the world. One of them in Bangalore, Caremongers, which was a story done by our group of how they're inviting people on Facebook. And after the story, the number just sort of grew. So I will say the other role is to get these volunteers, make them aware of what's being happening on the other part of the country, and media connects the dots there. Then you ask, how are people living if the caregivers are not there? I would say that in terms of those who've been employed in different setups, especially in hotel industry, especially people with disabilities who've overcome their challenges and were employed in different offices, it is a difficult time because from public transport to even the companies that are shut, there is a big question mark on whether they will be able to come back to those jobs, or because of the economic consideration, when there is a job cut, they will be the first one to face the axe compared to the non-disabled people. And I think that's where the real role of the media will also be, to highlight such cases and to make policymakers aware of what can be done to ease that pain.
Thanks, Devina. Sujata, I'd like to come to you now. What more can mainstream media do? Does it need to be to become more specialized? Does it need to sort of to reorient itself towards to catering for the requirements of persons with disability, or do we look for a completely new paradigm, in the sense that we look for specialized media to be created for persons with disability to take forward this kind of awareness that Devina has just spoken about? You'll have to unmute yourself, please.
Yeah, we've been writing about this, about people with disabilities. But the thing is, I see we don't, my newspaper or newspapers that I read daily here in Chennai, we are not really focusing much on people with disability, which is a sad thing. But what I see is they have not come up to us and they have not represented themselves as a group, asking for some kind of support, asking that they be written about, except for sending a few press releases. Now, press releases won't take you far. Okay, you have to actually connect with the reporters. You have to connect with the media if you want yourself to be projected in the media. So just when we started this, I was going through a few press releases that I got. They have a lot of problems. Okay, they have issues with online classes, but not one organization has come to the media. Although we've been covering a lot of them, but not one NGO, not one of the disabilities rights group have come to us saying these are the issues. Please write about it. Please let us know. Now, unless they remain in our focus, we are not going to go to them and we're not going to seek them out. Now, we don't even know what's happening to them. They have to come to us. They have to tell us we have a problem. Please feature us, and we'll be there. We'll be asking all the right questions at that time. So it is not correct to say that mainstream media is not focusing or mainstream media is not taking up their issues. It is more like they are not. I think they are not making sufficient effort. See, already when you talk about online classes, just recently I was speaking to schools and teachers. Now they have issues with having children going online. Same thing. Nobody that I spoke to has ever spoken about people with disabilities, people who need special attention. Although I know people need a lot of special attention. So I have this one particular person who sent a link for books that people who are blind can read. So it was at that time I was thinking if a blind person has books, he's giving you a list of books that he can read online. Of course, there are lots of software that they can use. But I was wondering what happens to people with hearing impairment and physically challenged people are the most vociferous of the whole lot. Okay? But I don't think their issues are completely different, but the issues of people who can't read, who can't hear or speak, their issues are completely different and they haven't come to the media yet. That I can tell you for sure. So if you want me to seek out these people, then there must be some kind of reciprocation. That's when I'll know what's happening on the ground. Except that I know the government has given them some kind of, I think they've given some doles like 1,000 rupees for disabled people that the state government has announced. That's a good thing. But I think it's not just money, a lot of other things are involved. So now schools have already started, it's June, and all academic work has already started in schools. I have no idea what's happening with persons with disability. Nobody has come up and nobody has even started talking about it.
So, and I'd like to go to Subrata and Davina both to talk further about what Sujata has just outlined. Subrata, you mentioned in your opening remarks that there's actually a lot of opportunity here that's become available to persons with disability because the nature of this pandemic is one that it is in one sense a great equalizer. Everybody has to work from home. Everybody has to sit in front of the computer and do whatever they have to do. Now, in terms of that, first of all, what kind of availability is there for online training, online classes, and availability of online primarily? Because we've seen that ever since schools shut down and colleges shut down, we've seen a lot of students from disadvantaged sections of society being unable to properly access their lessons, their classes, and this is a huge problem. So on the one side, on the one hand, you've said that there's opportunity here, but there's opportunity again only for those who have an internet connection, who have a data plan. So if you could talk to us a little bit about that. First is that online connection, that data plan. The second is the availability of training and courses that people with disability, different kinds of disability, can access. Sujata just mentioned resources for visually handicapped people. Somebody has made a list and put it together of books that can be accessed online by visually handicapped people, visually challenged people. But is there something like that that's available?
See, it's a very interesting question. It is not that the disabled people will approach us because they're not aware of what opportunity lies ahead. This pandemic has, make us realize that only apart from living that you are living today, apart from that, nothing is essential. Now I am connecting it with the digital marketing. Now, madam says that people are not coming to us. They are not, showing their disabilities or their problems, what they're facing it. Uh, as Devina ma'am has said, that media's job is to connect this. It is not that everybody is aware of everything. I'm not aware of lot many things, but this is nature's rule that nobody wants to work. That is the basic nature of this nature's basic rule. All these chemical reactions happen only to complete the 8 atoms in their last orbit. If you see the periodic table, either you have to know there is 2 electrons in the last orbit to become a helium, or otherwise all others last orbit is having only 8 and the reaction completes. That means everybody don't want to work. Today, suppose if someone sponsors me to move around the world, and for moving, traveling, if someone is paying, I won't do anything. I'll move around. I'll travel all the countries. Now, digital marketing gives you that opportunity. I'm not talking about learning things. I am talking about whatever you love, you do that. Suppose you love to make the TikTok videos. Anybody can do that. For that, you don't need any basic qualification. You just need a phone with a connection and then do whatever you feel like. My only point, make as many videos as possible, and that's just know how to monetize it. That's the only single term. If you learn to monetize it, you can monetize your blog, you can monetize your YouTube video, your Instagram, anything, whatever you are doing. Like today data is basic knowledge. Whenever you're doing something free of cost, you say you are sharing your data, that way you're getting free of cost. Now use that in your favor. Suppose you love to share jokes, do it on the TikTok, and I'm sure down the line 6 months you will start earning. You do affiliate market. There is just one link on Amazon. Go to the Amazon page, go to the down buttons, you will find one affiliate button. Register yourself there and start promoting product of Amazon itself on your Facebook page. You don't need to make a website. So for disabled people who have the difficult in learning, the proper machine learning or maybe artificial intelligence, these are only big terms. It's basically nothing. It is just use internet in your favor, and whatever you feel like doing. You love painting, do painting on net. You love singing, sing on the videos. You love writing poetry, their poems, prose, anything, write on your blog. You love to cook, make the recipes on YouTube and post it. So my point is, see, I have been to all these disabled programs and I made those people. They're so happy people. They're happy in doing their own things. They don't try to mold them in your mold, because in pandemic we have learned that nothing is important in life. I might have costliest car, I might have a big palatial house, but these are all worthless. I just have to survive. So you are no better than those people who are stuck at home due to their disabilities. You are equal to them. So make yourself happy, feel whatever you doing happy, do it on the net and you will earn. Because ultimately during these 3 months, people who have survived, they have only one thing, that they have money, they have essential food supplies at home, or they can taken it from online or whatever things. So you need food, and for food you need money to survive. So these COVID has taught us proper way how to live. Don't show all those things that I am the people who are living on street and people who have PhD qualification or any other bigger qualification, they both of them try to survive on this. So first you cover that, everything will fall in place automatically.
Devina, I'd like to get your comments on what Subrata has just said. First of all, do you sort of agree with that, or do you think that it's a bit of an overgeneralization? Do you think that, for example, there are significant entry barriers that persons with disability, especially those who come from disadvantaged sections, so economically disadvantaged sections of society, would face? Is there also, in your view, a psychological barrier here?
So, Saurabh, thank you for that question again, because, Subrata, I would just say that I think we're just mixing too many issues. And the distinction with which you started by referring to the disabled people as they, you seem to be forgetting that's a reality which is lived by a lot of people. And when you talk about people with disability, even during pre-COVID times, and having reported, having done shows around it, having met a lot of people, having friends who are also disabled, we would wish that line doesn't exist, where we are all living in a world where you can just turn on your skills over the technological platforms and try and make a name for yourself and try and earn money. But unfortunately, that's not the case, and more so in a country like India, where already we've been dealing with the problem of access, with, as Saurabh, you pointed out, high entry barriers, and simple things as having blind markers on the road, or having audio and visual aid for people with different kind of disabilities, and learning disabilities. Another big chunk, as Sujata mentioned, that there are different sects even in the group, and different challenges with those group. And just pre-COVID times shows us that how India has not been able to match up to its Western counterparts, even when it comes to just dealing sensitively with people who are facing these kind of problems. Now, coming to the question of sort of what can be done, I think Subrata is trying to hint that technology could be a solution, but I would say for how many people? And yes, we have around 200 million people on WhatsApp. We have over 300 million people on Facebook and YouTube, and we are the largest growing digital market. Data is cheap and all that and so forth. But is it also providing job opportunities with dignity? And will some people have to resort to more extreme measures? Now, when you ask me, Saurabh, is that possible for everyone? My simple answer is no. Even in the marginalized section of our society, those who are from poor background, I think that's the real story as well, because at least people who are in a better condition than the others will be able to ride it out together. There would be difficulties, but we'll be able to ride it out. But people who are from the poor section of the society, and I would just give you an example of stories covered of migrant workers, when tens and thousands of them have been on march to go to their native places. And has anybody actually talked about the problems faced by disabled people who are not able to move, and how are they shifting to their native places? How are they surviving in slum areas, which is also one of the highest contamination zones? So those are the stories, I think, which we need to bring out. And that's where I think a bit of sensitivity to realize the reality of the situation is required. And I would again go back to the point of we as people perhaps have forgotten that sensitivity, because we are so used to living in our own bubble. But as reporters, if we can train ourselves, and as media people, if we can train ourselves also to understand on how to perhaps ask the right questions and not generalizing answers, I would say would be a good start.
Thanks, Devina. And I'd like to go to Sujata now and put to her. Do you think that there is opportunity here for media companies, for all kinds of media, to get into the business of not only reporting news, but as Subrata has pointed out, that theoretically there's a lot of opportunity here. So putting together training modules or training capsules or training courses that are available online, that are, I mean, yes, India has the cheapest internet in the world, but there are still a lot of people who can't access the internet in India. Put together a system whereby in the time of COVID, this sort of training, specialized training that is customized to persons with different kinds of disability. Do you think there's a business opportunity here? Because to my mind, I think that's the only thing. I mean, if there's a business model, it'll get done. Would you agree with that?
Are you asking from the media's perspective? Can you hear me?
Yes, yes.
I said, are you asking from the media's perspective?
Well, you're a media person, so you would, yes, exactly. From the media's perspective, you think that there's that makes sense.
No, business opportunity for what? To train.
Well, to train, yeah. For example, put together an app, a specialized app that trains people in sort of how to videos that are I don't know, audio described, for example.
Yes,
Yeah.
I agree with you that yes, we should
So,
have.
do you think that there's a large market for that? And I'm going to come to Subratho to get him, since he's into digital marketing, to get him to respond to that. But do you think that this is the right way to go, given that unless there is business opportunity, unless there is a business model, these problems are not going to go away easily. I mean, by themselves, or even merely through initiative of the state and central governments.
See, in the US, there was this gentleman who started some 40-50 years ago to do
Could you speak up?
to do voiceovers for films and for television programs. At that time, people thought that was stupid because people understood English. So why would I even do a voiceover and subtitling? Sorry, it's not voiceover, subtitling. So the people thought, why would I even do that? It's not a good business module. It's not going to take you anywhere. But today, even in the US, he told me that a woman could be actually in the kitchen making sandwiches, but she can always go, just turn around, and you need not have to listen to the conversation happening on the television, but she can read and she would still glean whatever information she wanted. So there's an opportunity there. I mean, after 40 years, he's made his millions and he's looking cool, and he continues to do this work. So this is what you say. You find an opportunity where nothing exists. So I would also tell you something about this Robert Murrow, who was actually a radio reporter, and apparently in the Second World War time, he was actually giving you visual description of what was happening in Germany, what was happening in England, and he became a big person because he's become a world-renowned radio reporter. So there was an opportunity there. Nobody even ever thought that was possible. And so every one of his visual representations on radio, where you can't see it, you're only imagining it. He's made a career out of it. So there are people like that. But our own television, our own radio hit commentary. So we can always go back to that. People have not been able to replicate it on television is a different story. But then there have been people who've done a wonderful job being just commentators. So we can do that. I mean, there are opportunities, but I don't know what kind of opportunities you would find in the mainstream media. Yes, television has a lot of opportunities. People can make videos, but this is for people. So I don't know whether it is possible. People who have problems with who have hearing impairment, people who are visually challenged, what kind of opportunities you can provide them, I have no idea. But I think, yes, for visually impaired people, what you can do is you can ask them to read, let us say, a story, and they can actually go into the character and they can give you, they can bring live a whole story. I mean, that's a talent. So they can build on the talent. But these are all just imaginative things I'm making off here. I have no idea if it should be possible. That's what I'm saying. And
all right, I will circle back to this issue. I know Devina has something to say about this, but first I'd like Devina to take an audience question. The question is, when will the media make news consumption more inclusive? We don't see any of the big channels using sign language.
Well, thank you again, Saurabh, for that question. And I'll come to that, but I want to actually contribute to what Sujata said just a short while back, that what about media jobs? And that's an important question, because if you're the fourth estate claiming to represent inclusivity, then you should also be practicing it. And I can very proudly tell you, Sujata, that my horizons were actually also widened when I started working with an international organization, because it helps you understand of various ways which we think are mind blocks for us, where it can, where it's actually not. You have a show on the BBC Travel Show, and I really encourage you to see it. It's called Traveling with Tony. And Tony is a visually challenged person, and he takes you actually on a tour to different countries. Ethiopia was the last one before the COVID lockdown. And it tells you from his experience and from the sounds around. And these are cameras just shadowing him, just like any other regular reporter, and tells him what he's feeling. And it's an audience barrier that you actually break, and the stereotype that you cannot have a visually challenged person go around the world without any assistance and have a good experience. And that's what the program tries to show. And I think it's done it wonderfully. You have podcasts, which is the one that I was listening to recently was Ouch. And that talks about celebrating stories about disabled people, invites them as guests, and what are they doing to initiate community discussion. And a lot of times they're also hosting it. So I think that's another way in which media contributes. Kate Pounds is another British journalist, and she actually did a story around, and she's not with the BBC, so I'm not plugging the channel anymore, but she actually did the story around her experience of taking the tube, which is the metro in London. And being a visually challenged person, you have to touch different places. And what was her experience when there is a containment fear, there's a transmission fear? How was she able to do that and reach to her workplace? So I would say that it's just about breaking these stories and looking at it from a different perspective and being open to it, which can be done, which is being done. There is always an annual diversity report that is published in the UK. I strongly encourage our policymakers to do that here as well, which keeps a track of how many organizations are actually giving jobs to disabled people. And it also talks about media and how many jobs have been given by them. People who are interested, I can talk to you offline about it. But sort of coming to the question that you asked me, that should big media houses have bulletins with sign languages, with different aids? I believe, yes, they should. And our state-owned television, Delhi Doordarshan, actually had a program where you have constantly a person translating the news in sign language. Similarly, the BBC also has certain programs. There's one channel dedicated where the news is translated, just like what Nazmeen is doing right now. And I think that's a really good way of inclusivity. And why do the other Indian news channels don't do it? I think commercial considerations are a factor here. I think also the way they also have to look at the TRP rating wars that we have seen, and it's not hidden from anyone. Being part of the system, I can tell you it's a huge burden for any private broadcaster. So unless there is probably a help from the policymakers, I would say for the domestic news, it would be a difficult time to change towards that. But yes, there should be a change.
But it sounds like more of a coding problem rather than anything else, isn't it? At this point of time,
I wouldn't know. I wouldn't be able to get you on that sort of. What do you mean by coding problem? If you can elaborate.
Well, I mean, if you can, we've got animated artificial intelligence news anchors today. Mm-hmm. There are channels around the world that do that sort of thing. Mm-hmm. Surely something like sign language is something that can be coded for, right?
I'm not sure if we have reached that stage, honestly. And even if you're using or experimenting, I would say, with robots delivering news, it's not a good sign for journalists like us. We still need our jobs. But I would say that it is doable. Nobody is disputing the fact that it's not doable. Why it's not done is where I was coming from, that perhaps one of the considerations could be the cost considerations, and could be the news TRP wars, where we know that you have to deliver from one news to the other. You have to be fast. You have to ensure that you're keeping the audience hooked with different kind of panels on the screen and graphics and 15 windows for different guests. So I think that takes precedence, and that's unfortunate, but that's the reality. How we can change it, I believe, could be not through probably getting another sign language robot. I don't know whether that'll be a solution so soon, but certainly what can be done is to learn from a state broadcaster, learn from different countries' broadcaster who actually have sign language people who are translating news simultaneously, which can be used.
Thanks, Devina. Subrata, I'm coming back to you now. First, to address the issue that we had talked about earlier, which is that of whether there is there is the scope of a business model in training persons with disability. So if you could address that, and then there are a couple of more questions that I want to put to you to take the discussion forward.
Okay. Yes, there are business opportunity lies in it. If the more people involved in training of this kind of environment, then I think business would be rising more. It is not only business. Business happens only where the need is there. Since we have identified that there is a need, because I have been to this kind of seminars earlier also, I interact with these people. Devina has an objection that I referred it as a they, because it is some other organization. It is not my organization, and somebody from that organization invited me. That's why I referred them as a they, as a Sarthak. In fact, I have been associated with Sarthak in earlier programs also. So that's why it was never been to anybody demeaning. Not that. Secondly, as a journalist, Devina has pointed out very good questions. Like she has raised the point of the migrating people and the people in slums with the disabilities with them. See, it is not with us anybody that I can give a solution for whole, for 100% people. Even if 1% of the people's life can be changed with my initiative, I think I should be happy enough that I have changed someone's life. My point is only that, because with the people having disabilities, they have caregivers, they have other people where also cost incurs. And when we are comparing that cost with the only mobile and internet connection, which is just 250 rupees a month, it is just peanuts against that cost that I'm talking about. When I'm saying that you are having already a phone and just 250 rupees a month, if you can earn 10,000 rupees, so people who are associated with the people with disability, they also have a relax in their mind that after me, there is something with these people on that they can survive. Caregiver, for a disabled people, they need money. Even their daily activities, they have to have someone, and for that someone, he or she, need to sell out some money to them. My only point is to make them self-sustained on financial. If that can be done, even if the 5% of total population that I'm talking about, at least I can solve that 5% problem. It is so business model is there. We can go in, in our organization also we have a point that first it's a fun, then learn, and then earn. So there is fun element to learn, and when you learn, then you start earn. So the people like me who also involves in this kind of activity, so for them it's a business also. For me, it's not business. I go there as a my volunteer service and my call for these people that I need to share something from this society. I have earned, so I like to do something for this society. So that's it. But obviously, as you said, there is a business opportunity. I cannot deny that.
I'd like to take an audience question now, and this is for all three of you. Media should publicize success stories of persons with disability, entrepreneurs, and those who do well while working from home. Please comment what should be the strategy to actually make this happen. Entrepreneurs who have who are persons with disability. Now, ideas, any of you?
Okay, so I think it's a great question. And I think that's what I started off with, that media is an important platform to salute these good Samaritans and also to bring about stories of fighters, and that inspires other people, that motivates people who could be in similar situations. And it's pretty much the role that you'll see across different stories that's been reported around COVID as well. And I agree with you that yes, there needs to be more stories around people who are fighting and surviving. And there have been actually, and I think what if I can connect Sujata, Subrata's pointers as well, is that what we've seen in today's time is technology being a great enabler. We've seen platforms like podcast, platforms like social media, Twitter and Facebook, and even the Zoom chat that we're having right now, which enable these kind of stories to reach to audiences like you, because earlier we did not have these kind of platforms, and it was very restrictive traditionalist media of, say, a newspaper or a television organization, which would be driven more so by commercial considerations, space which is limited for news, space which is limited for the news that the audience might like to watch through the editorial decisions that are taken. But now, because of these democratic mediums, I would say, our news is also democratized, and that has given us option to go and explore more subjects and reach out to more people. And social media has, as Subrata I think mentioned just a short while back, has been a great leveler as well, because the moment you see news on different social media outlets, which may not be an established news organization, but those organizations who are, say, doing small digital videos, those organizations that are doing small Facebook lives, and they're going to those places and trying to find out how people are living in the scenario with different kind of difficulties. Those news are then picked up by the mainstream media, and that's how the transition has been. Also, because there is more need right now for news which is away from the regular news, that's where we also see a lot of these stories being covered. And I think it's a good time if people are trying to reach out. But Sujata mentioned just a short while back the glitch in the system, or the gap in the system has been that not many people are forthcoming to share their stories, and the accessibility, because most of us are in a lockdown, we are remotely working from our homes, so the accessibility has been more of a concern. And I think if we have more people and more organizations putting us in touch with what people are going through and these success stories, there is a need, and there is also a lot of demand for such stories to go ahead.
So there's a link up problem. Sujata, your views on this?
Just when we started talking, one of my colleagues has written a story about two people with disability in one of the slums here in Chennai. They are distributing groceries. So I was just going through that. It's just come uploaded just now on the Hindu's website. So since we're asking, I thought I could share this with you. But yes, people, like you said, now since it's lockdown, we are again in total lockdown now. It's like next 12 days. So we don't have access to people per se. Like, how do you meet people? There's no way to meet them, and most of them wouldn't have phone numbers of all the media people. So how are they going to reach out to us unless they have our phone numbers, and unless they think it is important? They are not going to reach out to us. So more often than not, our connection is only with the organizations, um, people who work, disability rights activists, who have their own agenda, who have a very set agenda, and we end up focusing on that. So we are constrained because we cannot move out. It's not just me in Chennai, my colleagues elsewhere also aren't able to move out. Most journalists aren't able to move either within Chennai or within Tamil Nadu, because suddenly yesterday they've declared another lockdown. So we just rely on our own contacts to find out what's happening to them. They haven't come, like I keep saying, we need people to open up to tell us what the issues are, so that we can really take it forward. We can carry their information, carry their stories to our readers, so that they also know what exactly the ground situation is. For instance, I really don't know what's happening with people with visual disability, although a lot of times when I've met them, they've said, with this white cane and all is not enough. And most of the things that the state government is, or the central government is doing, is outdated. We have much better sensor, shoes with sensor. This was one thing somebody told me. When the buses were supposed to have auditory information for them, they said that's not what we are looking at. We are looking at shoes that have biosensors that can actually pick up sounds and what they call vehicles that's coming towards them. So this was one thing one of the visually impaired person came up with. So this is the kind of information I would be looking for when I want to do a story. so that I can find out who really needs my help, how I can take it forward. Now I'm not getting that feedback, and I need that feedback if I want to do a better story, if I want to reach out to more of these people with disabilities and help them get out of, at least be able to tackle this issue. And frankly, nobody has come out and told us during this COVID period what their problems are, except for a couple of press releases which has been talking about being given money. I understand what I think Saurabh said. Saurabh, right? So I understand what he said. So that you need to be financially well off to be able to do anything at all. I agree on that score because most people are dependent on their families if they have one. Or as far as I know, blind people more often than not are relying on the social structure around them. And right now, they can't rely on any social structure, especially because you can't get out of the house. So how are you even going to reach out to them? And there are no apps at all to, apps are the simplest thing you can have on the phone. You don't have even apps that can reach out to you. Now, this is not only about people with disabilities, I'm telling you about even elderly people. They can't move out. So who is going to help them get their grocery or help them get their medicines? So the elderly are as much as disabled. That's all I would say.
So, Subrata, this seems like a problem that should be able to have a solution. I mean, you're in digital marketing. Are there ways to get around this? Should there be an association of entrepreneurs who are also persons with a disability, like a sort of a chamber of commerce or a union? Should they put an app together? What do you think? You'll have to unmute yourself.
Before this digital marketing that I had started, I used to be a journalist. I working in Delhi, and then I was a documentary filmmaker. I think, according to the Sujata ma'am, whatever she had said, that nobody is approaching us or nobody is giving us. See, it is basically we are disabled to understand their problem. It is our disability. We cannot expect that they should be vocal or they should reach you and then only you react. There are something, proactivity also is there. So during this documentary making, I was making one film for this DC Handicraft under Ministry of Textile, and I made 50 films in different cluster of India where handicrafts has been promoted, and it was one of the livelihood channel for them. Now these are the forced artisans. They were never artisans in their life. So they were, somewhere there is no rains are there, maybe some drought is there, maybe some part of like Assam and all, there is a flood is there. So they need livelihood. And during that process, the people from, villages or, less privileged places, they, coming to the metro cities or the bigger cities for the employment opportunity, and government's aim is to send them back to their own places and generate some livelihood for them. So it is basically the people who are having opportunities in their life, they need to reach these people. And again, Devina, it is not these means that, and the people who have less opportunity, reach them. See, if in pandemic is not going to prolong for years to altogether, maybe down the line 2 months or 3 months it will stop and we all move out. In fact, today I am speaking to you from my office. So my office is open from last Monday. So we are operating. So it is only we have to take some precautions and we have to live with COVID. So we are opening up. Now it is our responsibility to reach those people who need some kind of support at this moment. I mean, for overcoming their disabilities. And as Devina rightly pointed out, that we need to promote the heroes and we need to discuss their struggle from zero, from scratch, where they have came and they have achieved this success. Unless until we highlight that, cannot we cannot only celebrities coming to my studio or my office, I'm just taking an interview and just putting in the paper. It's not. I have to highlight their struggle in a way so that people who are in a less privileged position, they can also find that okay, I can do that. So in their struggle, if there is something which is a kind of problem, it is not approached by anybody. That's not. I have to identify the problem and it is within our solution. I have to make it in that way so that it will be motivating for the people. I think there is a lot of opportunity, and media has a bigger role to reach. That is for media. It is not that if as Sujata said, nobody is coming to us. It is not if tomorrow Devina sitting in the BBC office expects that news will coming to her and then only she put it on the wave or maybe in newspaper or TV. It's not. She has to have resources to reach to that particular news and bring out the common people. That is her job. So if we are sensible enough and we have a better privilege than the other, then we have to utilize our resources, make it available for the common people or people who have lesser privileges in their life and make their life happy. That is what I think.
30 seconds. We're running out of time very soon. So Devina, final remarks?
Yeah, I mean, I think what Saurabh has said is just what every editor would say: go and do your job and get your sources out and get your stories together. But let me tell you that there are ways in which the stories are also told. And as I said, I come back to the point of sensitivity, that I think whenever we are doing the discussions around a sensitive topic, we do need to realize the reality of it and also not paint everything with one brush stroke. But I think the answer to your question that you asked, Saurabh, is that perhaps the policies that are already in place for reservation of jobs for disabled people, especially in government jobs, whether we can have a sort of follow up on that, whether we can do surveys like what's being done in other countries of how many organizations are employing how many disabled people every year, and keep a track of that, incentivize that, in fact, as well. I would be more in favor of those policies. And last point is when you said, how can you encourage more stories? There was one story that's been reported quite widely, and I would then credit this to the democratization of social media, was how a labor who was going from Rajasthan and Western Indian state to Uttar Pradesh, and he had to steal a cycle for his disabled son because there was no other way that he could reach his village. And he wrote a note to the owner of that cycle: I'm really sorry I have to steal this for my disabled son because I don't have any other way to reach my village. And that story was a purely story picked up because it was reported on the social media by the owner of that bicycle, and garnered a lot of empathy and garnered a lot of support. And this person was identified and help reached him. And I think that's the role of media that we're all looking for, the positive role, which will only enhance in the coming days. All we need is a little bit more of two-way communication, and all we also need is a little bit more help from different organizations so that such stories which may not find their way on social media can also reach us timely and can also be given to the audience in the manner in which they can understand more sensitively.
Sujata, 30 seconds. Final remarks.
So I agree with what Devina said, that you have to have organizations come and give us information. We all rely on that. Right now it's COVID, so most of us are only looking at stories that can really, let us say that will have a heart in it. Okay, all of us are looking for only those kinds of stories. We really want to write beautiful stories, and given that there is a huge space crunch in newspapers, most of the stories don't find their way to the print. At least if they find their way online, and that's the best thing that can happen to us, because online it gets shared much better. Okay. The other thing I wanted to say was, yes, we do get a lot of people coming from organizations who want help, but sometimes that help is not actually help. They have. I'm sorry to say this, but they have an agenda. They are driven by an agenda, which even if they are people with disabilities, and we are sensitive to their requirements, but then they cannot take us for a ride. Okay? It happens to all of us, and so we have to guard ourselves against all this. So we have to be very careful what kind of articles, what kind of reports we end up writing. We don't want the next day for our seniors to come back and tell us, couldn't you have checked it better? Now, how am I going to do that? Now, in this particular situation in COVID, I think it's now 3 months. I have not been going out at all. We've been told very clearly, you take care of yourself. Now, if I don't take care of myself, who else is going to take care of me? I know it's a very sad situation, but a lot of my sources who are with disability, they can get in touch with me, they can call me, they have my number, but they haven't done so. Okay? And like Devina said, yes, social media sometimes misses out stories, and if they are able to give it to us, we gladly carry. It's not like I'm lazy journalist or anything like that. It's just that I just cannot go out now. That's all. I cannot do the kind of stories or kind of field reporting that I used to do, or I
It's
am
difficult
supposed
to chase stories or do enterprise journalism at this point.
Yes, right now I can't go anywhere. So it's like I'm as bad as like I don't want to say this, but I'm just at home stuck. So that's it.
Well,
How do I do it? I have no idea.
right. Well, hopefully things will change soon. As much as we might be stuck with COVID-19, we have to figure out workarounds and ways to start telling these stories properly, the way they deserve to be told. Thank you, all three of you, for taking the time out for this session, Sujata, Subrata, and Devina. Thank you, Rosemary and the American Center for hosting us, and Sarthak for putting all of this together. I'd like to offer a special thanks to Nazmeen, who's done such a wonderful job of interpreting for us. And at this point, I'd like to hand over to Atul Bhatnagar, who's going to summarize all the sessions, all the discussion and discourse that's been going on. Atul, over to you.
Thanks, Saurabh. Wonderful discussion, and I will come to it after I finish the first two. It'll be kind of a synopsis for everyone who was not there earlier. So we started off today at 11 o'clock by a topic, governance support to disability community during COVID-19. The panel was moderated by Mr. Krishan Kalra, who is former president of AIMA, and he's a board member of Sarthak. Now, he likened the situation to be a hydra-headed monster, which most of the panelists seem to agree. And he talked about the PWDs feeling vulnerable as they are constrained more than ever before because you know they can't even get out of their houses and or they can exercise their senses. I mean, like what Sujata said, we are all holed up. We want to be safe, and they are more than ever constrained before to be able to get out at all. Dr. Jitendra Agarwal, now he's the founder CEO of Sarthak Education Trust. He mentioned that each adversity has led to some new opportunities. Now, coming from a person who is visually impaired and the CEO of an organization like Sarthak, Sujata, I'm giving you some indicators. That's a story to start on. It's to be a CEO is not easy, even with all kind of abilities and faculties. And here's a person who's running this show end to end, and he is seeing an opportunity in this adversity. When we are all talking about how to keep ourselves protected, he has gone ahead and done this. Now, he has started online therapy and counseling sessions for children requiring early intervention. Now, it should be known that now this is again another story, that if children can be treated very early between 0 to 5, then there is a good chance that the diversity or the disability can be taken care of in future lives, might be cured also. And by the way, there are immense stories, and Dr. Agarwal can tell you about that. It happened in early intervention center itself. There are 50 corporates who approached Sarthak for wanting customer care executives working from home. There are 350 trainees who got jobs during this COVID era. Now, that's unimaginable, but it has happened. So there are some very good things happening in the background. There are new job roles we want. And that's where I think the media is going to be a very big contributor to those job roles. Content writers, editors, sitting at home kind of stuff that you can do. And I'm telling you, some of these people who are so-called PWDs have got their sixth sense better than all the five senses of ours. And then there's a mobile app being developed by Sarthak. In fact, I'm quite closely involved in this. We are wanting to reach out to PWDs no matter which part of the country they are on, giving them access to information on schemes, jobs, seek help where required. And now, because more than ever before, online training is becoming the norm, so we can do that too. Dr. Muni Raju, he was from Niti Aayog, and he talked about how they have reached out to civil societies, Niti Aayog, and registered with them, and how with the help of NGOs they're trying to get across to PWDs. An advance of some 3,000 has been made to PWDs to have their medicines, healthcare support. Now we should be, this is something very important. How when a lockdown happened, and for us, it was even difficult to even get our vegetables and milk. These people have to have their medicines, and they might have to go for physiotherapy sessions and what are the kind of healthcare giving support, but they couldn't. Then our guru and mentor of Sarthak, Mr. Dr. M.B. Athre, he's a Padma Bhushan awardee. He made a presentation on the impact, needs, and opportunities during COVID. He stressed on the information delivery, and I think that is what is key for the media, information delivery. Now, the government keeps announcing new schemes. We guys listen to it. We can criticize it. We can, some of us read the lines, some of us read between the lines. But some of that information has never reached some of these PWDs at all. How does that happen? I think media can play a part, whether it's social or mainline or whichever part media, but there is a role to be played there. We need an updated database to reach out to the PWD so the services that are meant for them can be reached out to them. And that's where a little later, another panelist mentioned this. Now, Dr. Love Verma, he's a former Secretary, Government of India for Department of PWDs. He talked about the womb to tomb approach. Now, that's a very nice term, how to do womb to tomb. And it's not one glove fit all kind of stuff. It's like for type of disability, how do you guide that person? How do you mainstream that person from womb to tomb? Then the Disability Act of 2016 needs to be implemented in a faster manner, something for the media to take in. What's left, what is there, what's not been implemented, what are the problems being faced by it, that's another thing. Now, portion of CSR to be allocated. Now, we keep hearing about the 2% CSR for companies' average profits, etc. But part of that 2% CSR, can that be allocated to PWDs? When I say this, it becomes easier for the CSR implementer or the foundation that the corporate is running that you can use that money for PWD use. It's easier to prove it. The board can get it. CAG doesn't go after you that you spent money unwisely or didn't as per not to the project guidelines. Then Tarika Roy, she's the Joint Secretary, Department of PWD. She clarified the status of various government initiatives underway for PWDs. We didn't know. I actually hadn't known of these. She stressed on being the fast learner because the situation is really requiring a learning curve, a very steep learning curve. I can't blame the government for not being ready. None of us was. Nobody in this world was to see such a big pandemic. She mentioned the database is being developed, and she has an online counter in her room where she mentioned the figure of 44.8 lakh people being given a card as their, I won't say Aadhaar card, but some kind of a card. I haven't seen that. Out of 83 lakhs people who are going to be contacted on PWDs. So a lot of work happening. Now it's a matter of how do we take it. One very interesting thing she mentioned was sensitizing the RWAs, which, on the initiative. So that's a very nice thing, if you can get taken care in your home, in that society, then nothing like it. Now, the second panel, which happened around 2 o'clock, was to discuss the aftermath of economic disruption on disability, diversity, and inclusion. Program moderator was Dr. S.M. Gupta. He was the Global Chief Operator Officer for StarTech. He outlined 3 challenges: accessible healthcare, employability, and financial support. And the panelists gave their own views on it. Gayatri Ramamurthy, Senior Director and Diversity Inclusion Lead in Capgemini, said 94.7% were work from home employees in Capgemini. They have a 4-pillar approach: accessibility, career to attract talent, engagement, PWD with project teams, evangelize what is happening outside the system. What was very attractive was this engagement thing. In a typical IT company, you don't have much of bench. Between one project to another project, you keep jumping on. So you're working in various project teams. So for a PWD person, by the time he or she gets familiarized to a set of people, he or she has to move to another one, and so and so forth. That becomes a big challenge, but the company has recognized that. And they're talking about a lot of mental health and learning and meditation. So these are things which, many of us can think about and take forward and disseminate. Now, you are the media. These are things you can probe further. Shruti Mishra, lead, who's the people and organization partner for Puma, she said an agile approach is a key to responding to the current situation. Managing lives and livelihood. Now, that's an important thing. It's not about just look, are you mentally okay and you're physically okay, you're getting your medicines in time or not? What about livelihood? I mean, if you're not getting your salary in time, or if you're getting salary cut in time, then how are you going to manage your own family? And that's a very critical thing for the PWDs. Then PWDs are staying alone in a bachelor accommodation, and the organizations are taking care of it. This is what mentioned by Mr. Vijay Thakur from the Leela Palace. Nandini Mehta, another thing that Vijay Thakur talked about, I didn't know this, and this was a revelation to me. There are over 840 touch points in a hotel, and they have to be taken care of. Hygiene factor. Each one of us will be worried when you go to a hotel, either to see someone or stay or have a meal. There are 840 touch points, and this has been time and again been repeated to the employees and retrained, because it's so essential that whenever somebody is going to such a, in the hospitality industry, doesn't get affected or doesn't get have an infection through COVID. Nandini Mehta of Lifestyle mentioned, look, they're using WhatsApp and video with sign language to communicate with hearing impaired staff, which again was quite a revelation to me. They've started online deliveries, and now she's talking of Lifestyle, which is Home Center, Lifestyle, and Max, and all these stores, which are typically brick and mortar stores. They have started home deliveries, and they not only do home deliveries, they're also trying to get the customer's attention and the faith that the product that reaches them is not contaminated in any form. So these are some of the very beautiful, say, pieces of knowledge that came to me earlier. In today's session, again, it was a great thing to talk about media. And Saurabh, I'm happy that you tried to get the media lens on PWDs, and you kept asking questions on how certain things can be done for PWDs. And Devina, well, job opportunity with dignity, fantastic. That's a very nice thing to look at. Then sensitivity to PWDs to ask the right questions. Well, along with that, then Sujata mentioned, well, no NGO has come forward to them for highlighting or featuring the PWDs. I would only say, I think it's a two-way, communication is always two-way. So if you do reach out to a person like, say, Dr. Jitendra Agarwal, he will be able to tell you 100 stories of this kind, and you can go forward and do that investigation further, whether what he's saying is the right thing that happened. So media does this investigation, but you get a lead somewhere. And I think the lead can best come is from Subrata. I mean, Subrata, you are in the social media space, you are in the cyber space. And I think, like the way, I mean, whenever I'm looking up some news item, and suddenly, if I have ever looked for a table lamp, suddenly those things start popping up. So you can literally sniff the mind of the customer or the reader or the viewer. I think from you, some of these stories can carry to the mainstream media. That's my suggestion. Well, I'm not supposed to give suggestions. I'm not supposed to only summarize. But having listened to the conversation, I thought this would be a very nice thing. You've got a very key, let's say, role to play in getting this mainstreaming of PWDs and PWDs problems and their attention. I loved what you said about learn to monetize your talent. I think that's very key. I mean, no one wants to just keep writing articles and not get any paid for it. And affiliate yourself to Amazon, that's something we can all look at and take this forward. So thank you very much for airing your views. And last but not the least, on behalf of Sarthak Education Trust, I would like to thank the team at the American Center, Digital and Outreach Partner, and UNICEF, Yuva Knowledge Partner. They actually did a rehearsal yesterday, and I appreciate their effort. Today's sessions have gone through without a hitch or a glitch. Along with them, I would recognize the efforts of Bhavna and her organizing team to bring this function to fruition. And may I request all of you to just compliment the organizing committee, the American Center, UNICEF. A lot of clap to them. Thank you very much.